NHS doctor warns millions taking common pill at risk of serious health problems in a world where pain relief is often just a pill away. The ubiquitous use of nonsteroidal anti-inflammatory drugs NSAIDs like ibuprofen comes with significant health risks that are not always apparent to the millions who rely on them daily. Dr. Mark Porter, an NHS doctor, has sounded a clarion call about these seemingly innocuous medications, warning of potential life-threatening complications ranging from stomach ulcers to heart attacks and strokes. Understanding the threat, NSAIDs and stomach ulcers. Dr. Porter's caution stems primarily from the fact that NSAIDs, which include familiar names like ibuprofen, aspirin, diclofenac, and naproxen, are associated with a heightened risk of developing stomach ulcers. These ulcers, which can occur in both the stomach and the duodenum, can lead to severe complications such as bleeding and perforation. Dr. Porter underscores that while many recover from these ulcers, some cases can be catastrophic, resulting in hospitalizations and, tragically, fatalities. The scope of the problem: each year, tens of thousands of people in the UK alone find themselves hospitalized due to NSAID-related complications, with a significant proportion succumbing to the severity of these issues. Dr. Porter notes that approximately 1 in 10 individuals who develop a peptic ulcer may never return home, underscoring the gravity of the situation. The risk of bleeding from these ulcers poses a particularly ominous threat, necessitating immediate medical attention to mitigate potentially fatal outcomes. Factors increasing risk: dosage and drug interactions. According to Dr. Porter, the risk of developing NSAID-related complications such as ulcers and bleeding increases with higher doses and prolonged usage. Moreover, the concurrent use of certain medications amplifies these risks exponentially. For instance, combining NSAIDs with selective serotonin reuptake inhibitors (SSRIs) commonly prescribed for depression, or steroids like prednisolone significantly heightens the likelihood of experiencing adverse gastrointestinal events. Beyond ulcers, cardiovascular and renal risks. The dangers associated with NSAIDs extend beyond gastrointestinal issues. Dr. Porter warns that these medications can elevate blood pressure, increase the risk of heart attacks and strokes, and exacerbate conditions like kidney disease. For individuals already managing cardiovascular conditions or renal impairment, the use of NSAIDs demands careful consideration and monitoring due to the potential for compounding health risks. Safe alternatives and precautionary measures. In light of these risks, Dr. Porter advocates for judicious use of NSAIDs. He advises opting for alternative pain relief methods whenever possible, suggesting paracetamol acetaminophen as a safer alternative for pain and fever relief. For those already prescribed NSAIDs, especially for chronic conditions like arthritis, he emphasizes the importance of pairing these medications with acid-suppressing drugs such as omeprazole or lansoprazole. These measures can help mitigate the risk of gastrointestinal complications by reducing stomach acid production. Managing NSAID use effectively. Dr. Porter encourages individuals to be proactive in managing their medication regimen. If prescribed an NSAID without a concomitant acid-suppressing medication, patients should inquire about the rationale behind this decision with their healthcare provider. Additionally, for those on long-term NSAID therapy, adherence to acid-suppressing medication is crucial, even if its benefits may not be immediately apparent. Recognizing dangerous combinations. The risks associated with NSAIDs are further compounded when combined with other medications such as aspirin, diuretics, and anticoagulants like warfarin, rivaroxaban, or edoxaban. Dr. Porter advises individuals to remain vigilant about potential drug interactions and to consult their healthcare provider promptly if any concerning symptoms or side effects arise. Conclusion: practicing caution for optimal health. In conclusion, while NSAIDs provide effective relief for many common ailments, their use demands careful consideration and management. Dr. Porter's insights serve as a critical reminder of the potential hazards associated with these medications, urging individuals and healthcare providers alike to prioritize safety when prescribing or consuming NSAIDs. By adopting a cautious approach, using the lowest effective dose for the shortest duration, and monitoring for adverse effects, patients can mitigate risks and safeguard their long-term health amidst the convenience of modern pain management strategies.